The government's planned legislation allows it to force people into treatment and jail them if they run away. Earlier I spoke with John Patterson from Aboriginal peak organisations of the Northern Territory, which includes land councils, legal agencies and medical groups. They say amendments by the Giles government only prop up a fatally flawed scheme and the proposed laws should be scrapped. John Patterson, welcome to the program.
Good evening, Claire.
The Health Minister says chronic alcoholics who escape mandatory rehabilitation can now only be jailed if they run away a third time. What do the organisations you represent say about this?
Look, the Aboriginal peak organisations still see the current legislation as it's drafted as a criminalised piece of instrument that's going to criminalise this whole process, whereas from our perspective, public drunkenness is more a social problem, and we should be looking at ways and means of tackling alcohol, those that experience alcohol problems, tackling the front end, being the preventative end, avoiding the situation which government is wanting to establish, and that's, the last resort. It's more like at the acute end, wanting to jail them, mandatory rehabilitate them, put them behind wired fences, secured facilities, rather than dealing with the problem up front. And that's where we're wanting to influence government and suggest to government, come sit down with us and let's talk about, those who've had many years of experience, talk about how we can best deal with the issues that we're all wanting as a community and leaders in our respective organisations and politicians and government to address the issues that we're currently experiencing in our communities.
The AMA says that the alcoholics who will be forced into mandatory rehab are severely damaged, will be absolutely rampant to get alcohol and will end up in jail. Does that fit with what the medical and legal bodies you represent are telling you?
Absolutely, and it's. I think we've got to listen to those peak other organisations such as the AMA Northern Territory, the Law Society and other peak bodies that have responded to the draft legislation, which government gave us a short period of time to respond to, saying that, this ain't going to work. There's no evidence around this.
Indigenous Country Liberals MLA Bess Price today raised the point that the experts criticising the scheme haven't been able to reduce the rates and effect of chronic alcoholism. Isn't that a fair point in favour of giving mandatory rehab a go?
Well, Claire, those again that have been working in the sector, those experts that are dealing with these problems on a day-to-day basis, have put up a number of ideas and solutions, potential solutions to these problems over a number of years. As I said, I've been sitting and watching and participating in some of these processes for the last 3 decades, and we've been putting them up to both, regardless of their political persuasions, both country Liberals and Labor parties. And it just seems to have fallen on deaf ears. Give us a go. We work with these issues on a day-to-day basis. There's some evidence and some research around that proves that some of these programs and ideas and solutions that we're suggesting to governments do work, and there's a strong chance of succeeding with those. Getting that 35 million that's currently being allocated towards this untrialled initiative which government wants to introduce, 35 million, we reckon we could give it a really good red-hot go at finding solutions, getting communities participating, getting governments participating, and those key service providers engaged in this process, empowering communities, engaging with families. So it's all that preventative stuff to avoid what government is trying to attempt, wait until alcohol becomes an acute problem for the entire community and then wanting to put them behind secured facilities on a 3-month basis. The patients are going to be released after 3 months basis. Our other major concern is what happens to them after the 3 months once they're released. They're going to have income management or other savings accrued back on the streets and back to square one again.
Well, on that point, Adam Giles concedes that not everyone will be rehabilitated, but he says that at least people will be off the grog and off the streets for 3 months. That's got to be some small benefit, surely?
Look, our major concern is the post 3 months. There's from what we've seen in the legislation, we can't see any evidence, any ideas or solutions about the post 3-month care or rehabilitation that individuals will be required to do. And as I said, they'll be back on the streets, back on the situation where they've found themselves prior to the 3 months going back in there and looking for another second 3-month period, undertaking mandatory rehabilitation. I mean, governments, please listen. I mean, we believe we have positive and constructive solutions. $35 million that you want to spend on an untrialled, unproven program would be better invested in some of the ideas that we've put on a number of occasions over at least the last 10 years to governments, both Labor and CLP.
Finally tonight, if there is a legal challenge, will your organisation be party to it?
The Aboriginal peak organisations will join in any legal challenge to prevent this unevidenced, unresearched initiative which the Northern Territory government is attempting to do, because we don't think it's still criminalising the program is still on a criminalised punitive measure, and we want it to be a more meaningful preventative measure. That's something that we will support.
Thanks for joining us, John Patterson.
Thanks, Claire.